day, everyone. My name is Hossein Kasmai, CEO and founder of Franchise Creator. Today, we're going to visit one of our clients in the medical industry. This urgent care concept perfected their clinic to offer an extensive list of medical services. And the good thing about this franchise is that you don't have to be a medical practitioner to own one. Let's go inside and learn more about this exciting opportunity. Welcome to the urgent care of the Palm Beaches. So I'm here with Dr. Salehi of the urgent care of the Palm Beaches. Dr. Salehi, it's a pleasure to meet you.
Pleasure meeting you, sir.
So I want the audience to get to know you a little bit better. So if you can give me some background about yourself, and that will be helpful for people to get to know you.
I am an emergency physician for the past 20 years. I'm an active practicing physician. I have served as a medical associate medical directors for multiple ERs. I also served as a department director for a different hospital, and sat on the medical executive committees for the hospital for years. And currently, I'm also an active practicing emergency physician.
Okay.
And affiliated as a volunteer teaching assistant professor for one of the major universities in Florida.
That's an amazing accomplishment, amazing background. So at what point did you decide that you wanted to have your own business and you started an urgent care, and why an urgent care center? How did you think of this idea?
As you know, the healthcare is changing significantly. It has changed in the past 10 years. And my interest in urgent care started when actually a friend of mine, we used to work together, started a large urgent care chain.
Okay.
And actually invited me to join him at the time.
To partner with you?
To partner with him.
Okay.
But I was, because of my family situation, I wasn't interested in that at that time. And then I accepted a medical directorship for an urgent care in our close by. After that, I have decided to start my own urgent care centers. And that's how I started it, opened the first one and then continued on.
So obviously you're an entrepreneur, and I gotta tell you, when it comes to physicians, and I know a lot of physicians, it's a very unique mix that you have the medical background with the tremendous achievements that you just mentioned, and on the other hand you have your entrepreneurial background. So you mixed the two, you started a business. When did you start this urgent care center, and how have you grown it since then? I know you have more than one location.
Yes, we have started in 2011.
Okay.
We actually opened after the construction. We actually opened up in 2012, the second half of 2012. And since then, every 2 to 3 years, we opened a new urgent care center, a new location. And that's how the progress been. It's been good so far.
Yeah, one of the things about healthcare is that, obviously, you depend on people with insurance and so forth, and I assume you accept all kinds of insurance here, correct? Some variety of insurance.
Correct.
Policies,
we
right?
accept all insurances, all the commercial insurances, Medicare, and worker compensation insurances.
Okay.
Yes.
So, Dr. Salehi, what services do you guys provide here at this urgent care center?
So an urgent care center is, I like to refer to this as like a mini ER.
Okay.
The benefits of urgent care is it saves you, just as a comparison to an emergency room.
Sure.
We do provide the same services that most of the services that you would get at a minor emergency room. That would include, like, if you any laceration repair, anybody with the cuts or bruises, minor fractures. If somebody falls with a broken bone, they can get the X-ray done in urgent care and a splinted. We call incisions ranging from abscesses, anything for cough, cold, testing, vaccinations, immunizations, and a slew of other services like workman's comp injuries and motor vehicle accidents, minor MVAs. The benefits of an urgent care compared to the emergency department is that the wait time is minimal in urgent care, and the cost is a significant factor. That's why the people are more lean toward using urgent care, and even the insurance companies like those better. They actually direct the patients to the urgent care center versus ER. Just to give you an idea, if you have a cold and you go to an urgent care center and you require a chest x-ray,
Of course.
your copay for urgent care may be $20, and then your insurance pays the rest of it, which is usually somewhere, around 100 or more to 200, I would say. But in an emergency room, the same service would cost you about 10 times as much.
Of course it does, yeah. And obviously, urgent cares these centers have been. They started probably in the late 80s, in the early 90s is when urgent cares, I remember, really becoming the go-to places in an emergency. I remember back before that, it was only emergency rooms is the only place you could have gone. And now these urgent care centers are growing more and more and more because people are using them all the time. I want to ask you a few questions about the operation itself. So obviously we're going to talk about franchising in a second, but I want the audience to really learn the meat and potato of this business. What does it take to run a business like this? So what staff do you need? What staff does one need to start this business? And go from this, from whether you need to hire a doctor, or you are a doctor that's going to be involved in a day-to-day. Talk about the staff that's required, please.
So first of all, you need a medical director.
Okay.
Medical director would be the one that sees the quality and also manages the physician assistants or nurse practitioners who work under them.
Sure.
In Florida, I know a physician does not have to be present. It can be a physician assistant or nurse practitioner work on their own, under supervision of the physician that is easily reachable, even by phone. The staffing you need medical director. Urgent cares almost all have an X-ray center. So for that, you need an X-ray technician.
Okay.
And then you need probably a medical assistant for the blood draws and getting the EKGs, and the front desk person to do registration and run the insurances. That's pretty much extended.
And do you suggest, okay, so that same person in the front also does the filing for the insurance as well, or do you outsource that?
You can have your own billing department, where you can hire somebody to do the billing for you, or you can outsource it to billing company. It is more convenient to have a billing company do it for you from our purposes.
Yes, it makes a lot of sense.
It makes it easier.
So one of the key things that I just read between the lines of what you said is you don't necessarily have to have a full-blown doctor in-house. You could have a physician assistant, you could have a nurse practitioner. Now, physician assistants and nurse practitioners here in Florida, their salary is significantly lower than a doctor. Runs anywhere from probably $60,000 to $100,000 a year, where doctors make significantly more than that. So your business, you've come up with a method of getting a lower salaried person who also provides the same quality of care, because they're under the supervision of the medical director, which happens to be a doctor, correct?
Correct. That's what the urgent cares usually do.
That's perfect, yeah. So it sounds like to me that you're running a very, very lean operation. You have again someone in the front that does running the insurance. You have the X-ray tech, and then you have, of course, the nurse practitioner or the physician assistant. Let's talk about the franchise. So at some point, you grew this business. You said that you continue to open new locations yourself. That obviously tells anyone and everyone that the business is successful, because you continue to want to open more and more and more locations. But obviously you can't do all of it on your own, so you decided to franchise your business. Tell me, what drove to franchising? What caused you to think about franchising your business? How do you envision your franchise growing?
So we, as you touched on it. We open every 2-3 years. They open a new location.
Correct.
So as the business gets bigger, it's more of a work for me. It will be more employees to manage, more locations, and more patients. At this point, my options were to I discussed with some banks, and it actually costs more to do. Every location you have to put in money and do more. And the options were go to franchise versus we do more investment over more locations and I'll oversee. And we decided that would be the best for our purposes, to franchise.
Of course.
And I love to teach. And we train all PAs in the correct ways. And I think that would be a good opportunity for me to have more time to teach.
Of course.
I'm also willing to teach the medical directors or franchisees, have confidence with them to take them through the stuff, even the business aspect of it. I think that gives me more time to spend with the franchisees and with the staff.
Okay. So obviously, who better to learn from than someone with all the background that you already mentioned, that you've already accomplished in your life as an ER physician. Dr. Salehi, we know that this center can be operated and owned by a non-physician. I want you to elaborate on that, because a lot of people that look at a medical facility like an urgent care center immediately think that, oh, I have to be a doctor to own one of these. Franchising has changed that rule. It allows people, non-clinicians, to also be involved in a medical facility like this. What do you think about that? What kind of a franchisee are you looking for?
I think it's a medicine, as long as you have the medical director that oversees the quality. In terms of running, healthcare has become a business, whether we like it or not. It is being run by businessmen. But again, it is a growing business and there is a lot of demand for it. And I feel strongly urgent care is an area of the medicine that is actually making it more convenient, cost effective, and helps a lot of people in that sense. For that purpose, I have no preference if the franchisee is a physician or a non-physician. The goal is the same, take care of the patients. And there are times who are non-physicians who actually do a better job running the business than the physicians, unfortunately, but that is fact for all the physicians. So in that sense, I think it's a great idea. And that's why a lot of states have changed the rules. A non-physician can own it. They may have to pay, I don't know what the exact fees are per state, maybe a larger fee per year to own the business, but
yes,
it's minimal.
There are some state regulations. Corporate practice of medicine is what they refer to it, but at the end of the day, majority of states, like you said, allow non-physicians, non-clinicians to own a medical facility like this. So what franchising, what you're doing, what you're allowing, what your franchise is allowing people to do, is you're allowing that entrepreneur who before could never get into a medical practice because a person like myself, I have no idea how to run a medical practice like this because I'm not a physician. You're allowing anyone without a medical degree to be able to get into the practice of running a medical facility and helping them. In many cases, like you said, they're better in business than a typical clinician and be able to grow it in a profitable way. As far as the franchise is concerned, tell me a little bit about what's needed here. And I know we're going to take a short tour of the facility so that you can show the audience exactly what everything, what's needed to run this place. But what kind of a location does someone need to buy or rent in order to launch a business like this?
The urgent care has grown significantly in the past 10 years, and I think it's one of the fastest growing businesses still in our country. The location-wise is usually you want a location where there's enough exposure. So for that purposes, the location-wise, initially for a person starting would be wise to pick a location that we can even advise on, that it has more of traffic flow,
A retail location.
a retail location.
How many typical square feet of a location? How many exam rooms do you require?
Typically, it can be from 2 to 4,000 or 5,000, depends on how big you want it.
As little as.
But a little 2,000 would do fine. Most urgent cares are somewhere around there, more or less.
Okay.
And then you will probably need about 5 to 10 exam rooms.
Okay.
Most places do fine with 5 to 7, and
So you have 5 to 7 exam rooms. You have your the front desk, and then you have an X-ray room.
you have an X-ray room, and you have a larger room for X-ray, and a larger room for lab where you do minor labs and procedures, and then you need a waiting room.
Sure.
And
Of course.
that's all it is.
Okay, fantastic. Dr. Salehi, what separates urgent care of the Palm Beaches from other urgent care services that are out there?
So the services we provide is across all urgent cares is almost the same thing. What separates us is the key thing we focused on as an emergency physician was a speed of moving patient in and out. That is a key factor, because if you're a patient, you have a cold, you're working, you want to go to urgent care center, the reason you're not going to emergency room, you're going to urgent care because you want to get in and out.
Correct.
So we have minimized our wait time to less than 15 minutes, which our patients love it. They keep coming back to us. Another thing we did is we are accommodating our patient to a higher degree than other urgent care centers. If you have a sickness, we see you. We usually do a follow-up calls, see how you're doing, and we actually bring you back again to go over the results with them or discuss the results and come up with plan of care. If they need to be referred to specialists, we recommend the people that we work with, and it has worked great. We had a great reception from the patients. Sometimes we see them and we refer them out, but they're not able to see their doctor for weeks. You know how the healthcare is these days, so they get lost in the system. So we bring them back, which actually is good for business, but also is good for the patients. We are also in network with all almost all insurance companies. That by itself decreases the cost to the patients because their copay is less, and also it sort of builds a bridge between us and the patient and insurance company, so the patient doesn't get stuck with a big bill, and the insurance companies work with us on that. That actually was very helpful for a lot of our patients.
Sounds to me like from one of the points that you brought up is you're putting some quality of service in your care here, right? So I've been to urgent care before, unfortunately, and I've been to an urgent care where you go in, you go out, you don't know the name of the doctor, you have no idea who they are, and you most likely will never go back unless you hurt yourself again or you feel ill. Sounds to me like you're providing quality of care that these people they're connecting with you, even though it's an urgent care center, but they feel like, I'd rather go to this urgent care center than make an appointment and see my doctor 3 weeks later.
Correct. We've had that just because one, we are there for them. Two, by nature, our business, we're open 24 hours a day, every day of the year. So it makes it more convenient for a lot of people to just walk in. They don't have to make an appointment. They can make an appointment, but they can walk in anytime. And we sort of learned that by experience and by nature. We realized that they like that kind of service. As much as I don't like to think about, but we are all in a business, and in a business, customer service always comes number one.
Absolutely, 100%. If you run any facility like a business, which a lot of doctors don't, and again, it goes back to what I said earlier. What interests me about this franchise, and I hope it interests the audience about this franchise and people that are interested in buying this franchise, is the fact that they're partnering with a man, with a doctor, with a tremendous background and accomplishment, but also is an entrepreneur. So he understands the business side of things as well, which makes this franchise very, very exciting. And tell me about the people that come to the doors. What age group do you normally see? I mean, are these mostly elderly, or do you get younger people as well?
No, we see all age groups.
Okay.
one of the things you can do in emergency room depends on your medical director. If you don't feel comfortable with this patient that is sick, you can always refer them to the ER. But we see all age groups. Most of our patients are adults. And then we do see any kids from anywhere from 2 years old to 90 years.
So you see kids as well?
Yes, we do see kids. So majority of them are middle-aged adults or older, over 65, that come to us.
Fantastic. And what days of the week are the busiest for you?
It all depends on what location you're at. I want to say Monday, Wednesday, Fridays are typical busier than other days.
Okay.
There are some weekend days we're busiest than our weekend days.
Okay.
It all depends on the location and if the patient population close to you is mainly retired populations or a working population.
And Dr. Salehi, almost all franchises operate the way they provide the franchise opportunity to a potential prospect is they pay a franchise fee up front, and then once they get the location open, they run the location, and whatever number of dollars that are coming into the center, a percentage of that goes back to the franchisor as royalty. I assume you're following the same guidelines, even though it's a healthcare center. People buy this franchise by paying a franchise fee up front and then paying a royalty based on sales that are coming in, correct?
Correct.
Okay. And the startup cost, again, I want to take a quick tour here and take a look at the place, but it sounds to me like a very low startup cost. So people open restaurants, they open retail operations where obviously it's an expensive build out. Here all you have is really a bunch of small rooms with a sink and and that's about it. And then of course you have the waiting area with a bunch of chairs. So the build out is not that crazy amount that you would have in other
Yes, the build out
businesses.
is not that much compared to restaurants and building kitchens and all that. Really just need patient rooms, which is basically a cabinet with a sink. That's the code. And your most expensive item probably is the X-ray machine.
Right. But that can be leased, correct?
You can lease it or you can buy it, yes.
Perfect. So the equipment, which happens to be the most expensive part of this, can be leased. So you can really start with a very low cost, and then of course
Correct.
you pay it on a monthly basis.
Another option on the terms of cost is you can actually buy the building that you're going to open urgent care and lease it to yourself if you have the money, or you can just lease the
location itself.
The
So that's
location.
one more way of that's one more hint for these.
There's one more way of building revenue. Your building cost goes up over year.
Of course.
It appreciates, and then
Of course.
be a return on investment.
Now you're doing a real estate play as well as
Correct.
a business play. So now I want to see the place, right? So we've all been unfortunately to urgent care centers, and it's a very simple setup, but I want the audience to kind of take a look at the center and the setup. So if you don't mind, let's take a walk.
Sure, let's do it. Okay, you ready to look around?
Sure. So this is your waiting room?
Yes, this is. As you can see, there's some chairs people sit on.
Okay.
And then this is the front desk.
Okay.
That's where they come in, they sign in, they give the insurance card,
Have a
and
seat.
once they're signed in, they wait, and then we'll take them back. Sometimes they don't even sit down. We'll just take them straight back to the room.
Excellent.
Let me take you through the room here.
So the waiting time is very little, is what you're saying?
Yes, that's what our goal is, to make it minimal, zero waiting time.
All right.
So this again is the waiting area. This is the registration area. As you can see, different rooms.
Correct.
They're all typical rooms. We can walk into one of them. I'll show you.
Yeah, I'd love to.
So the chair, there's a bed, and a sink basically. There's some cabinets where you have some supplies in there. It's a typical supply for urgent care. It's like a basic standard, like scissors and cotton tips, and some material for ACE and other
Perfect.
things here.
So the inventory for a particular franchisee is very little because all the things that you're showing me per room is not expensive. I don't see any expensive equipment in here.
No,
So,
the most expensive item may be your bed.
your bed.
Yeah.
That's it. And the rest of the
Yes.
stuff, this type of gloves,
Just
and,
standard, yes, yeah,
bandages
gloves
and all
and-
that is very inexpensive stuff. The cabinets.
Just think
you
of
have
it, the
sink.
typical patient you see comes in with a flu, you have your gloves on, you talk to them, you examine them, you wash your hand, and then you're done. Except if you need to do procedures like laceration and stuff, you set up a suture tray and you do that.
Okay.
It's pretty straightforward.
All right.
Okay.
So you have a few of these rooms, like you said.
Yes, multiple.
4, 5 rooms, 6 rooms is typical for any.
Correct.
location
Yeah,
to
you
have.
can get like somewhere anywhere from 5 to 7, 10, and you can have some urgent cares may have 10, 20 bedroom. It depends on how busy they are and how much demand is.
Got it.
Okay. No, look down. We're gonna go this way. So we're gonna walk this way to the. I'm gonna close this door in the waiting area. This is bathroom. This is our storage room where we
So a
keep
typical inventory.
supplies in here.
Okay.
Yeah, and then patient bathroom. Another room here is patient there.
Okay.
And storage.
Number of rooms pretty much
This is the
identical.
office room, yeah, where the people said, yeah.
Yeah.
And then this is our typical, it's basically our quick laboratory area. And where you come in is where we do a standard stuff, basic, like a strep screen, urinalysis, or a drug screen.
So you do all of that here.
Yeah, we do it. If blood draws, they get here and they get labeled and get sent out. And the computer is there. And then you have a mini fridge. Basically, you keep your like vaccines and stuff in there. They need to be kept at a certain temperature. So this is the X-ray room.
Got it.
And the patient come in. We can do a chest X-ray is done easier here. If they need an X-ray of the hip or legs, they need to lay down. There's a table usually required to have that. All the X-rays are digital.
Okay.
So the X-ray gets done here and it gets transmitted immediately to the provider room where they can look at the X-ray, and it also gets sent immediately to a radiologist where they give us a read.
So they have to have a some sort of a relationship with the radiologist, which you help them accomplish.
Yes, that's simple to do.
Okay.
You want to have a radiology overread just to protect. Some centers decide not to have an overread by a radiologist. That's okay. But we recommend everybody should have radiology read it.
And that radiologist directly gets paid by the insurance company, or does it get paid by
us.
the
We
center?
pay them, yes.
Very well. Okay. Excellent. So it sounds to me like a very simple operation. You have, it's like an office, almost like altogether, it's like an office building or office complex where you have small rooms and then a larger room for your X-ray machine. And then of course you have your bathrooms and you have your waiting room, and that basically is your urgent care center.
That's all it is.
And not a whole lot of machines, not a whole lot of expensive equipment, just a bunch of inexpensive beds and chairs, and of course you have the X-ray, which is the only machine that, as you said, could be leased.
Yes.
Okay, fantastic. So Dr. Saleh, it was very, very nice to meet you in person and also see the entire operation.
Thank you.
And thank you for showing us and the prospects that are interested in buying a franchise what the insight of this business or this medical facility looks like. For more information about this exciting franchise opportunity, please visit their website, urgentcareofthepalmbeaches.com, our website, franchisecreator.com, or simply email us, info@franchisecreator.com. Thank you.